A pilot program developed by Alberta Health Services is helping ease some of the psychological burdens of patients awaiting kidney and liver transplants. Believed to be the first of its kind in North America, the Coping Skills Development Group is aimed at reducing the depression and anxiety that often affect people on transplant waiting lists.
This program is born of an idea about how to help people who have chronic medical issues, that those medical issues we know are not going to get better necessarily quickly, and how do we do a broad intervention to help people rather than doing one-on-one psychotherapy, rather than trying to find talk therapy dedicated to change. How do we help people with the things that aren't going to change in their life? The medical symptoms, the problems that relate to sitting and waiting every day for something to come around the corner. And as you can imagine, mood suffers for that. Like your mood starts to sink, you become more anxious. And in being able to learn how to cope, and we call those skills of learning how to deal with that, coping skills, as we learn how to cope, those symptoms of sadness and anxiety get better.
Well, my colleague Dee Miner and I have developed a coping skills group. This is a group that we offer to pre-transplant kidney and liver patients, those who are waiting or are on the waiting list awaiting their transplants. It's a coping skills group that brings our patients together and allows them to, in a shared environment, learn about coping and how it impacts stress and how it impacts them.
And so we're really targeting behaviors around anxiety. So that would look at mindfulness, how to develop some emotional tolerance around anxiety, how to breathe, how to relax, and depression around some negative thought patterns, how to challenge negative thinking, how to really focus on interpersonal skills, because we know that those relationships pre-transplant and even post are really challenged.
Well, I'm on home kidney dialysis, and I have been for 6 years, and been on the kidney transplant waiting list for 7 years. And I found it the techniques very helpful. I think one of the most important aspects was the sharing, though, that I was able to do with the other members of the group. We all understood each other. We understood the difficulties that we're experiencing living on a day-to-day basis, and that was very helpful.
What we know is that transplantation is difficult for people. Sometimes it's a real adjustment to people's lives. And when you come into transplant with a great deal of emotional and psychological distress, transplantation may not take care of that. You know, transplantation may actually add to that. So when we have individuals pre-transplant that are struggling with things like depression and anxiety, that may get worse after transplant if they don't have the appropriate coping skills and supports in place to help them deal with that.
We've designed an 8-week coping skills program, so it's once a week for 2 hours at a time. It's a closed group, so people enroll into the program. We measure their levels of anxiety and depression pre-group. We do the group, and then we measure them directly after the group, and then 4 weeks after that. So we have 3 testing periods.
So far, 22 transplant patients have participated in 3 separate coping skills development pilot groups. Preliminary findings have been positive, with standard depression and anxiety scales showing dramatic reductions following participation.